Hi guys, how are you doing? I hope you are doing well and welcome to today's session of learning. If you are new here, feel most welcomed. If you are a member, welcome again. And if you have not subscribed, please consider subscribing and let's grow this channel. So, welcome. Today I want us to learn an interesting topic and very common because this is something you have seen. So I want us to learn about congenital abnormalities, okay? Or in another term, it's called birth defects, okay? So what is congenital abnormalities? These are those abnormalities that a baby is born with, okay? This is an abnormality that occurs when the baby is in the uterus, okay? So that means when this baby was developing in the uterus, everything didn't go well as expected when a baby is forming. These abnormalities, most of them occur in the first 3 months of pregnancy. That is when most of the body organs of a baby grows or forms. So you find that during this period, when a baby's organs are forming, some form with defects or abnormalities. So by the time this baby is born, you find that the baby is born with an abnormality. So today I want us to discuss about these abnormalities. I want us to know some of these abnormalities, and then what can we do to prevent or to help reduce the risk of giving birth to a baby with an abnormality, okay? So did you know that more than 8 million babies worldwide are born with congenital abnormalities? If you did not know, now you know. More than 8 million babies worldwide are born with abnormalities. As you can see, that is a very big number, okay? And then did you know that 240,000 newborns, you know who is a newborn? A newborn is a baby between 0 to 28 days. Did you know that 240,000 babies die? Imagine, 240,000 babies die, newborns die because of birth defects. Now you see how serious it is, okay? Because some of these babies don't survive because they are born with very serious abnormalities leading to their deaths. So one thing I know is there is no woman who wants to carry a pregnancy for 9 good months and then give birth to a baby with an abnormality. So today I want us to learn ways in which we can reduce the risk of giving birth to a baby defect. Some of these defects are of unknown causes, but there are some ways we can reduce the risk of giving birth to a baby with an abnormality, okay? So congenital abnormality causes disability, okay? They cause chronic illnesses and then childhood deaths. As I have told you, more than 240,000 babies die because of congenital abnormalities between the age of 0 to 28 days. Some survive for a long period of time, but some babies die between the first 28 days. So which are some of these abnormalities? Number one, we have Down syndrome. Very, very common. Down syndrome. I think most of you have seen a baby with Down syndrome. We have spina bifida, anencephaly, anorexia, microtia, cleft lip and cleft palate, and also we have congenital heart defects. Okay, so these are some of the common abnormalities, and I think you have seen one or two babies, or you have seen a baby with one of these abnormalities that I have mentioned. Okay, so what can we do to prevent giving birth to babies with abnormalities? We have number one, adequate intake of folic acid. Folic acid is very important. Any woman who is planning to conceive should start folic acid. Immediately you plan, even before you conceive. When you plan that you want to conceive, start folic acid early, before conception. If you get a pregnancy that is not planned, immediately you notice that you have conceived, start folic acid. This folic acid helps your baby to develop. It helps to reduce the risk of having a baby with spina bifida and anencephaly. Okay, we have adequate care during pregnancy. What does that mean? Eat a balanced diet. Okay, make sure you eat whole grains, eat proteins, eat fruits, eat vegetables, eat a balanced diet. Okay, avoid alcohol intake and tobacco use. Avoid smoking. Okay, we have those moms who are diabetic. If you are a diabetic mom and you have conceived, make sure your blood sugars are well controlled, because when your blood sugars are high, they increase the risk of giving birth to a baby with an abnormality. Okay, you also have avoid exposure to hazardous substances like heavy metals, for example, mercury. Okay, we have avoid exposure to x-rays. Anytime you are pregnant and you go to the hospital, remember to inform your doctor that you are pregnant, because there are some tests that you are not supposed to do, like x-rays. Okay, exposure to those x-rays can harm your baby. And also screening for infections. Okay, some infections during pregnancy can expose your baby to congenital abnormalities. So that is why it is important to follow up with your antenatal clinics anytime you have an infection. Okay, we have UTIs, we have sexually transmitted diseases. Make sure you go and see your doctor. Okay, we have diseases like syphilis. If not treated, they harm your baby. Okay, we also have using over-the-counter medications. Anytime you are pregnant, please make sure you tell your doctor whenever you go to the hospital, because there are some medications that are contraindicated. There are medications that you should not use when you are pregnant. So make sure you inform your doctor, so that when he or she's prescribing medications, she does not prescribe medications that are contraindicated during pregnancy. Also, another point, do not take over-the-counter medications. If you have a headache, don't just go to the pharmacy and buy over-the-counter medications, because you will find that you have taken medications that you're not supposed to take. So do not prescribe medications for yourself. Okay, so please let's stick to those points that we have said, because they really help you during pregnancy. When your baby is developing, you know, this baby barely depends on you, like everything. Okay, in terms of nutrition, this baby depends on you. So if you don't take a balanced diet, then your baby is not going to get enough nutrients. Okay, you need enough calcium. If you don't get enough calcium, it will affect your baby during bone formation. If you take alcohol, you expose this baby to congenital abnormalities. Okay, you expose this baby to in issues with the lungs. Okay, because you know this baby is delicate, the organs have not formed, and then you expose them to very harsh environment by taking alcohol, tobacco. These things will harm your baby. Okay, so I know giving birth to a baby with an abnormality is expensive. It is draining. It needs a lot of energy. It needs a lot of your time. So I know those moms who have given birth to babies with congenital abnormalities, the first thing, you will be shocked. Okay, because no mom expects to get a baby with an abnormality. Every woman, when you carry a pregnancy, you expect a healthy baby after 9 months. So if it happens that you get a baby with an abnormality after 9 months, you might be shocked. Okay, you will go into a denial state, anger. You will ask yourself so many questions. It's okay to go through all those emotional processes, but at the end of the day, these moms need a support system. Okay, they need to come to acceptance, and they need support system. Okay, and do not be worried. Those moms who have babies with abnormalities, there are so many people who are willing to support you, and also there are so many services available for your babies. Please accept this baby as any other baby to the family, because also if you reject this baby, it will be so hard for you to care for the baby. Okay, so you need to go through all these emotional processes. You will be shocked, you will go into anger, you will go into denial, and then later, after some time, if you get a good support system, you will have to come to acceptance and then show this baby some love. Okay, because it's not the baby's wish. Okay, and also it's not your wish, so you're not to blame. Please accept the baby to your family. Let the baby feel some love like any other baby who has been born to the family. This one will help you. It will make it easy for you to care for that baby. Okay, ask your doctor so many questions. Ask all those questions that you have. Your doctor will help you to understand this baby. By asking those questions, you will get to know, you will get to learn the care that your baby needs. Okay, and that one will be easier. I know it is expensive. Caring for a baby with a congenital abnormality is so expensive, guys. These babies need extra care. They need a mom's time. Okay, 24/7. Like these babies need a mom's love 24/7. These babies, their developmental milestones is not the same as these other babies. That's why they are called babies with special needs. Okay, So if you ever come across a mother who has a baby with a congenital abnormality, please can you support where you can, because those moms have a very big challenge. Okay, it is even hard for the moms to these babies to work, okay, unless they get someone who they trust with that baby, who they know can take good care. Some moms end up quitting their jobs to take care of these babies. So please, can we show some love? Can we show some support? Can you give anything that you feel like can help these moms? If it's emotional support, give them support. If it's financial, go ahead and help them, because those babies are expensive. Okay, and there are special services for those babies. So if you happen to have a baby with those special needs, do not hide your babies in the house. Okay, nowadays we have special schools. These babies with Down syndrome, they have special schools where they go. They have nice teachers who understand them, so they help them. We have occupational therapy where those babies they go and they meet that therapist who help them. We have speech therapy. You see, we have so many services available for them. Okay, so show some love to those babies with congenital abnormalities. Do not look at those babies like outcasts. Show some love. They are just babies like any other baby. It's only that they were born with an abnormality, and it's not their wish. It's not their wish. And anybody can get a baby with a birth defect. So let's love those babies. Okay, today I wanted to create awareness about these babies with congenital abnormalities. Let's improve their health, okay, and quality of their lives. Let's improve their health and quality of their lives, okay, because they deserve everything. They deserve everything like any other person. When they come to the hospital, can we give them a first priority? Okay, can they get a good quality of life? Because that is all they need. Okay, so I think that is it. If you have any question, ask me down there in the comment section. Those moms with babies with special need, babies with congenital abnormalities, do not give up. Okay, there are so many services available for your babies. We have occupational therapists. Ask. We have speech therapists. They will help your baby to know how to talk. We have occupational therapists. We have special schools where they go to learn. Okay, we have so many services available. Okay, so do not give up. Show some love to that baby. Please love them. They are part of your family. Okay, be happy. You see, be happy like you have given birth to a baby. Welcome that baby to your family like you would have welcomed a baby who was born normal. Okay, so that is it for today. Thank you so much for watching. Please remember to subscribe. See you in the next session of learning.